What if I told you the single most important prostate habit takes less than 30 seconds and costs nothing, and that most men over 60 are doing the exact opposite? Can 5 simple habits really save your prostate after 60? The short, careful answer is yes. Many men see meaningful improvement when they adopt a few targeted daily habits. I'll explain how, what to do, and what to expect, with clear steps you can start tonight. I'm Dr. Julia Morgan, a board-certified urologist who has worked with men over 60 for more than 15 years. I see the same pattern over and over. Men assume prostate problems are an unavoidable part of aging and either accept poor sleep, reduced confidence, and constant trips to the bathroom, or they rush to medications and procedures without trying low-cost, low-risk steps that often help. Today, I want to give you 5 practical habits backed by clinical experience and research that target the real drivers of symptoms: pressure, poor circulation, inflammation, oxidative stress, and hormonal shifts. These habits are ranked so you walk away knowing which ones make the fastest, biggest difference. If you want more science-based strategies for men over 60, hit like and tell me where you're watching from in the comments, your city or country. That helps me tailor future content. To understand why these habits work, let's look at the prostate in simple terms. Imagine your bladder as a water balloon sitting on top of a small sponge, the prostate. When that sponge swells, it squeezes the little tube that runs through it, the urethra, and flow becomes weak, starts and stops, and you feel urgency or get up at night. There are 3 main forces behind that swelling: mechanical pressure from the bladder and abdomen, reduced blood flow that prevents the gland from clearing inflammation, and cellular stress from oxidation and hormones that favor growth. The good news is that all 3 of these are influenced by daily behavior. Over the next minutes, I'll walk through 5 habits ranked from #5 to #1. For each, I'll say why men underestimate it, the mechanism in plain language, a simple protocol you can follow, a short patient vignette, and what kind of timeline you might expect. These are practical, low-cost, evidence-supported changes. None of them guarantees a cure, but many patients experience significant symptom reduction when they combine them. Let's begin. Habit number 5. Walk 30 minutes every day or 3 10-minute walks. Many men think intense exercise is required to help the prostate. That's not true. Consistency matters far more than intensity. Walking is the single most approachable activity for men over 60, and it does several things at once. It improves pelvic and pelvic floor circulation, boosts general cardiovascular health, lowers abdominal fat, and helps regulate insulin and hormone balance. Think of better circulation like turning on a small pump that flushes away inflammatory signals and brings oxygen to tissue that has been starved. Protocol: aim for 30 minutes of walking most days. If 30 minutes straight feels like too much, break it into 3 10-minute walks before breakfast, lunchtime, and late afternoon. Keep the pace brisk enough that your breathing is slightly raised, but you can still talk. For many men, consistency every day is more important than speed or distance. Clinical vignette: a man in Chicago in his mid-60s, busy, desk-bound, and waking 3 times nightly, started walking 3 times a day, 10 minutes each after work. Within 8 weeks, he reported fewer nocturnal trips and a stronger morning stream. He felt steadier balance and lost a little belly weight, which helped overall comfort. Expected timeline: improved frequency and better sleep may begin within 2 to 8 weeks. More structural benefits, less abdominal fat, and improved hormonal markers show up over months. Research signals: observational studies and activity-focused analyses, including large cohort work, show associations between regular walking/physical activity and lower urinary symptoms in older men. While not every study proves causation, the balance of data and clinical experience supports walking as a safe, effective first step. Many hook to the next habit. Walking helps circulation and burns fuel for inflammation. Now let's remove one of the most common bladder irritants most men underestimate. Habit number 4. Limit alcohol to no more than 3 drinks per week. Alcohol is a bladder and prostate irritant for many men. A drink in the evening can increase urgency, make you need to urinate at night, and alter hormone balance in subtle ways. Alcohol increases bladder sensitivity and inflammation, and it can worsen sleep quality, meaning more awakenings and poorer recovery. Many men don't connect their nightly beer or glass of wine with worsening symptoms. Protocol: set a weekly limit, 3 standard drinks or fewer per week. Spread them across days rather than binging in one sitting. Replace your nightly drink with a non-alcoholic ritual: herbal tea, sparkling water with citrus, or a small fruit snack. If you take medications or have liver disease, check with your doctor before changing alcohol habits. Clinical vignette: a man living near Melbourne who had a nightly habit of 2 to 3 drinks cut back to 1 drink twice a week and replaced the nightly drink with a lemon water ritual. Within 4 to 8 weeks, his nighttime urgency dropped and he reported a calmer bladder during the day. Expected timeline: many men notice a reduction in urgency and nighttime trips within 4 to 8 weeks after reducing alcohol. Sleep quality also improves, which reduces daytime fatigue. Evidence note: observational data point to relationships between alcohol quantity and lower urinary tract symptoms. While the evidence is not definitive for every context, limiting alcohol is a safe, inexpensive way to reduce bladder irritation. Many hook to the next habit. If walking increases blood flow and cutting alcohol removes an irritant, this next habit targets your prostate cells directly. Habit number 3. Eat cooked tomatoes at least 3 times weekly with a little healthy fat. This one often surprises men. Tomatoes contain lycopene, a plant pigment that studies suggest may reduce oxidative stress inside prostate cells. Crucially, lycopene is absorbed better when tomatoes are cooked and eaten with fat. Think olive oil in tomato sauce. This is not a magic bullet or a substitute for medical care, but it's a dietary habit with biological plausibility and supportive observational signals. Protocol: aim for at least 3 servings per week. 1 serving is approximately half a cup of cooked tomato sauce or 1 cup of cooked tomatoes, roasted or stewed. Cook them with a splash of olive oil, or eat them over pasta, beans, or with eggs. Tomato-based soups, stews, and sauces count. Keep salt and added sugars moderate. Clinical vignette: a man in Toronto with a gradual rise in PSA and bothersome nocturia added cooked tomatoes and olive oil to his meals 3 times weekly. Over 6 months, he noticed fewer nighttime awakenings, and in follow-up, his PSA trend stabilized. We saw a modest biochemical improvement in line with lifestyle changes. Expected timeline: effects on symptoms may be noticed over weeks to months. Measurable changes in markers tied to oxidative stress and PSA tend to appear over several months. This habit complements the others and is most effective as part of a broader pattern. Research signals: population studies and some interventional reports suggest an association between lycopene intake and improved prostate-related measures. These findings are encouraging but not definitive. Lycopene-rich foods are a sensible, low-risk addition. Many hook to the next habit. Addressing circulation and cellular stress helps a lot, but if excess weight or belly fat is present, it adds fuel to inflammation and hormonal imbalance. Habit number 2. Lose roughly 10% of body weight if you are overweight. Focus on portion control plus walking. Excess abdominal fat isn't just a cosmetic issue. Fat tissue produces hormones and inflammatory substances that can encourage prostate enlargement and worsen urinary symptoms. Losing approximately 10% of current body weight often shifts this hormonal balance in a favorable direction. This is about sustainable changes, small reductions in portion size, and steady physical activity, not extreme dieting. Protocol: start with a practical approach. Reduce typical portion sizes by about 20%. Prioritize vegetables and lean proteins, and use walking, habit number 5, as your activity foundation. Small swaps, half your plate vegetables, smaller dinner plates, skipping seconds, add up. Aim for a gradual weight loss of 1 to 2 pounds per week if safe for you. Consult your primary care physician if you have complex medical issues. Clinical vignette. A man in Newcastle, carrying extra abdominal weight, trimmed portions and walked daily. Over 6 months, he lost about 25 pounds, roughly 10% of his body weight, and reported markedly fewer episodes of urgency, less nighttime waking, and a stronger flow. Objective measures in clinic showed improvement that matched his symptoms. Expected timeline. A modest loss of 10% body weight can begin to change symptoms and hormonal markers over several months. You may notice better sleep and less frequent urination as the scale moves. Caution: don't rush weight loss. Sudden, extreme diets can be harmful. Use steady, sustainable steps and get medical guidance when needed. Mini hook to the next habit. These 4 habits reduce inflammation, improve circulation, and correct hormones. But there's one habit, simple and immediate, that often makes the single biggest difference for men. Habit number 1. Don't hold your urine. Respond within about 5 minutes when you feel the urge. This is the habit I emphasize most with my patients. Holding urine habitually stretches the bladder, increases pressure on the prostate, and creates a pattern of retention and incomplete emptying. The image I use in clinic is a sponge under a brick. When you hold, the sponge gets squeezed, it stays inflamed, and the tube through the center gets squashed. Over time, holding can weaken bladder contractility and make symptoms worse. Protocol: adopt the 5-minute rule. When you feel the urge, plan to empty your bladder within about 5 minutes. If you're in a situation where you can't get to a restroom, traveling, meetings, aim to find one as soon as you reasonably can. Avoid turning holding into a habit. For hydration, plan so you have access to restrooms. Hydrate regularly rather than gulping large volumes infrequently. If you use diuretics or medications, coordinate timing with your clinician. Clinical vignette. A man from Texas who had routinely delayed urination for convenience, waiting through meetings or long TV programs, started following the 5-minute rule. Within 6 weeks, his daytime urgency faded, his nocturia dropped, and his confidence improved. He described getting through movie nights without anxiously planning every restroom stop. Expected timeline. This habit often produces the quickest perceptible change. Some men see improvements in frequency and urgency within 2 to 6 weeks. Structural changes that reduce gland swelling take longer, but the behavioral relief is fast. Why it ranks as number 1. It's immediate, free, and targets the mechanical pressure that directly causes many functional problems. Changing this one behavior often reduces the chain reaction that leads to worsening symptoms. How the 5 habits work together. These 5 habits are not isolated fixes. They create a virtuous cycle. Walking increases circulation. Reducing alcohol removes a common irritant. Lycopene-rich cooked tomatoes reduce oxidative stress. Weight loss shifts hormones and reduces mechanical load. And not holding urine breaks the mechanical pressure cycle. Together, they address the main drivers of bothersome symptoms: pressure, poor circulation, inflammation, and hormonal imbalance. What can you realistically expect? Many men notice symptomatic relief in weeks, a reduction in nighttime trips, less urgency, and a stronger stream. More structural and biochemical changes, reductions in gland size or PSA trends, typically require months of consistent effort. In clinical practice and in the literature, combining lifestyle steps can produce large symptom reductions for many men. Some reports and cohort data suggest up to roughly 50 to 70% improvement in symptom scores for people who adopt multiple habits consistently. Remember, that varies by individual, and these numbers are not guarantees. Some men will still need medication or procedures, and that's okay. These habits often reduce the need for escalation or improve outcomes if treatments are used. Practical way to start tonight. Pick one habit and begin immediately. The most practical first step for many men is habit number 1, stop holding urine. Start tonight. If you wake up and feel the urge, get up as soon as you can instead of waiting. If you tend to have a drink before bed, swap it for water earlier in the evening or a non-alcoholic drink. If you commit to one change tonight, add a second tomorrow, perhaps a short walk and a portion-controlled dinner with a tomato-based side. Aim for consistency rather than perfection. A habit practiced most days will beat a perfect plan that never leaves the page. Safety and red flags: when to seek immediate care. This information is educational and intended to guide behavior that is generally safe for most men, but it is not a substitute for individualized medical advice. If you experience any of the following, seek prompt medical evaluation. Severe pain in the lower abdomen, pelvis, or back. Visible blood in the urine. Sudden inability to urinate, acute urinary retention. Fever with urinary symptoms. Rapid worsening of symptoms over a few days. If you have complex medical conditions, take medications that affect urination or clotting, or have had prior pelvic surgery or radiation, check with your primary care physician or urologist before making large changes to activity or fluid patterns. Evidence and how to interpret it. I want to be clear about the evidence. Some of the studies I referenced earlier are observational cohort studies and trial signals that show associations. Examples include lifestyle research from Japan showing links between activity and lower symptom burden, analyses in journals like the British Journal of Sports Medicine highlighting the benefits of physical activity for urinary symptoms, and nutritional cohort work connecting tomato intake and lycopene with prostate markers. These findings support the habits I recommend, but don't promise definitive cause and effect in every case. In my clinical practice, however, the combination of improved circulation, reduced irritants, better diet, modest weight loss, and the simple behavioral change of not delaying urination translates into meaningful improvement for many patients. Real-world patient examples. Brief, anonymized. Florida. A retired naval officer who had 3 nightly awakenings, reduced alcohol intake, and added walking. After 2 months, he slept through more nights and regained daytime energy. Boston. A seminar attendee who was frustrated with urgency began the 5-minute rule and found his anxiety around outings dropped within weeks. Chicago. The desk worker I mentioned earlier, who combined walking with portion control, saw improved stream and fewer nocturnal trips in 2 months. Toronto. The gentleman who added cooked tomatoes and olive oil 3 times weekly noticed both symptomatic improvement and a stabilization in PSA trend over 6 months. Newcastle. A man who lost 10% of his body weight via portion control and daily walking reported major symptom relief in half a year. Texas. The patient who stopped habitually delaying the bathroom regained his confidence and reduced nocturia significantly within 6 weeks. These vignettes are anonymized and reflect common patterns I see. Small, sustainable habits stack up into significant change. Common questions you might have. Will lifestyle replace medication or surgery? In some men with mild to moderate symptoms, lifestyle change reduces symptoms enough that medications are not needed. In other men, lifestyle measures complement medication or surgery and can improve outcomes. We never promise that habits alone will replace medical therapy. Each case is unique. How strict do I need to be? Consistency is more important than perfection. Missing a day of walking won't undo weeks of progress, but repeated lapses will blunt benefit. Start small and build. Are there risks to these habits? These are generally low-risk interventions. Walking, moderate alcohol reduction, dietary adjustments, and timely voiding are safe for most. If you have heart disease or other mobility limitations, check with your doctor before beginning new activity. If you have bladder control issues, pelvic floor therapy may be useful. Ask your clinician for referrals. Checklist to keep this practical. Tonight, start the 5-minute rule. Respond to urges promptly. This week, add 3 10-minute walks or a single 30-minute walk on most days. This month, reduce alcohol to less than 3 drinks a week and add 3 servings of cooked tomatoes with healthy fat. Over months, aim for sustainable weight loss if overweight, about 10% of body weight as a meaningful target. At each step, Track your nightly awakenings and daytime urgency. Small wins keep you motivated. Final words of encouragement. Aging doesn't mean resignation. Small daily choices have outsized effects on how you sleep, move, and feel. These 5 habits are practical, affordable, and grounded in biology and clinical experience. You don't have to do everything at once. Pick one habit tonight and build from there. Many men regain sleep, confidence, and comfort with consistent effort over weeks to months. If you notice severe symptoms, blood, sudden retention, or significant pain, seek medical attention promptly. For personalized guidance, talk with your primary care doctor or a urologist who can help tailor these suggestions to your health profile. If this was helpful, subscribe for weekly science-backed tips for men over 60. Leave a comment with where you're watching from and which habit you'll start tonight. Will you pick the 5-minute rule, a daily walk, cutting alcohol, adding cooked tomatoes, or focusing on steady weight loss? I read your comments and they help shape future videos. You can reclaim restful nights and steadier days. Start with one small step tonight.